So today we're going to melt the fat and suction the fat above the jawline, below the jawline, in front of the ear in this parotid region, the jowl, and then we're also going to get this strip where he has some volume in the submental region. So now we're going to quantum this side of the face. And I'm going to start the quantum as I pull back. You can hear the cracking and crackling and popping of the subcutaneous fat. That's a great sign. But I'm going to get this lower jowl, pulling back, and now I'm moving into the neck. So it's called a fan distribution. We're fanning the radio frequency out. So you really want to get as anterior as you can first. You really don't want to target the proximal region. You want to get distal to your insertion point first, because it'll be more difficult to come back to this area later without over suctioning. And we'll do one more pass with the quantum. Pretty much the same energy and same distribution as before. When you put your cannula into place, put it into position, pull back 1 millimeter or 2 or 5, and then start your retrograde technique. We're going to get this anterior part of the neck again. And now we're going to move on to the Morpheus8 portion of the procedure.
I'm going to be going vertical first, and then I'll go horizontal for my second pass. We always pair them together here at our practice. We include it in a package, so anytime they get quantum for their neck and jowls, we have them do 3 sessions of Morpheus. Quantum's kind of targeting that subcutaneous region underneath the skin, and so we also want to pair it with something more superficial, which is going to be the Morpheus, just to kind of get all the layers to contract. We're all done now. I did 2 passes, and then I did a 3rd pass right here in his main area of concern at a little deeper depth, 4-5, and he'll start to see results in 6 to 8 weeks.